Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. You get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies.
So,
go ahead. It's all yours.
Ladies first, if you like.
Oh, you're so thoughtful.
Yeah, I love giving away my free book because it helps other people learn and how you can avoid surgery. I mean, that's the big deal in terms of musculoskeletal medicine. I treat really anywhere from the head down to the neck and shoulders and the back and the ribs and low back, neck, whatever, hips, knees, toes, fingers, wrists. Did I say elbows? Shoulders. The whole body. Muscle tears, tendinitis, tendinosis, you name it. ACL ruptures, I get those all the time. And if you know anyone with an ACL rupture, make sure they have a doctor with an ultrasound. That means you can look inside the body, who can aspirate the blood out before it clots up and makes that knee very difficult to heal. ACL ruptures, typically, if you're going to do it, if the knee is really loose, which it usually is not, and it's not needed to have surgery, but occasionally, make sure you wait about 3 months before you do that surgery, because the knee can often heal on its own, and we see cases of ACL ruptures that actually heal up, okay? Well, we have a bunch of callers, Mike, so we're going to drop you for right now, but we love you for calling in. And we're going to go to Carol. Carol, you've got right knee pain. How long have you had it?
Yes. Hi, doctor. Thank you for taking my call.
Sure. Thank you for calling in. We love our callers.
Right knee, and I know you're not into the MRIs until you see somebody, but it's the meniscus. It says I can't find the MRI, but they did an X-ray, something involving the posterior horn of the medial meniscus, and then
that's common.
Extending. And so on and so forth.
Sure. That's common. And the thing that's common about it is a lot of people have that who don't have any pain, and I'm one of them. Both my knees have meniscal tear.
Say that again.
Sure. It's very common to have meniscal tears in the knees and rotator cuff tears in the shoulders and herniated discs in the back and not know you have them, okay? So when you say you have that and you have knee pain, I'm going to tell you that there's a real good chance your pain is not coming from that meniscal tear. And if you can get around and you can bend your knee, I would say don't do the surgery that you might have been suggested. Has anyone told you need a surgery?
Well, this sort of started with the cervical. It's like you have cervical stenosis, and then I have the rotator cuff tears, and then I took a fall, which may or may not be related to the knee, but then 2 weeks later, I had this, pain, and that was on the right knee, the meniscus. And so I've been doing physical therapy, and the doctor did give me, I had to take a trip to Hawaii, so I had sort of one of those, something that you wear on your leg, I can't think, a stabilizer. And she gave me, I believe, a shot of, I can't think right now.
Cortisone.
It just took a little of the edge off of it, and then I've continued with physical therapy and on all those body parts, but because you have to walk on your leg, that's the most annoying. I haven't done any surgery, and then she did some kind of a hyaluronic gel, and that didn't seem to do anything.
Okay.
So I'm going, okay, what about stem cells or platelets or coming to see you and have you, examine it and read any of the literature you care to
Sure,
read.
sure. Well, I'd love to see you. And if you want to come to the
Okay.
office, the phone number is 800-300-9300. There's people that can take your call and give you more information.
Yes,
But
I've
just
got
from what
that,
you're just from what you're telling me, Carol,
There's
I
what?
can't. From what you're telling me, from your history, there's a good chance that doing platelets and/or stem cells will heal your knee, and I can't tell you really for sure anything until I examine you. I'm not against MRIs. I like them. They just give false information about where your pain is coming from. So all I hear from you is meniscal tear, meniscal tear, meniscal tear. But did you hear me say I have meniscal tears in both knees and I have no pain? And I'm going to go running today and play golf today?
Yes, I did.
And I have two rotator cuff tears in my right shoulder, in the subscapularis and the supraspinatus, and I have a labral tear in my shoulder. I have no pain. I can weight lift. I can do whatever I want to. I can play golf.
Well,
So don't let these images, how can I put it? I don't know the right term for it.
well,
Don't let them lead you to a
difficult.
surgery.
I'm using a cane and I'm sort of, trying to walk and do stuff. I'm not taking lengthy walks, just trying to do
Sure.
what I need to do.
Right,
And,
right.
as I said, I've been doing physical therapy where he's trying to strengthen different areas. He's worked on various areas of the
Sure.
body that I've described.
Well, it's all good. It's just that if you want to come in and have me look at it, I'd be more than happy to do that and give you
Yes.
my humble opinion on what's going on.
Your location? You're not in Orange County, are you?
No, we're about 20 minutes north of LAX Airport, across from UCLA on Wilshire Boulevard in West LA.
Okay. Oh, I'll get the address from the office then.
Yeah, it's worth it.
Okay.
A lot of people say
Yeah.
that's too far to go, and well, I don't
yeah,
know.
hey, we've got a lot down here in Orange County. Maybe you could have a little subsidiary office down here.
I can only spread myself so thin, and I'm busy all day, every day.
I know.
And I joke with people when they say it's too far. I go, I have people fly in from different countries around the world to get treated, and it's worth it. Believe me,
Yes.
It's worth getting healed. There's nothing like a healing. It's my favorite thing on my
Now,
body.
With the injections, the platelets, the stem cells, I know you said side effects if a day or so. You should probably lay low. You're not going to be.
I don't want you to do a marathon the next day, but you
No,
do your
no,
normal
I don't
activities.
ever.
Yeah,
Yeah.
normal activities are fine. You just don't exercise
Right.
the area. Yeah. Yeah, I have people that come in. People come in, they get injected, and then I have them follow up in 2 weeks. And they come back and go, I didn't get any better. And I look at their chart and I know that they're a marathoner or a golfer or whatever their sport is. And I go, did you do any of those things? And they go, yeah. And I go, well, then why would you think you're going to feel better if those things are causing
No,
you
well, I'm
pain
not
before you
planning.
got here?
So is it usually 2 weeks intervals?
Well, it can be. It depends on what the situation is. There's a woman who came in from New Mexico with TMJ, temporomandibular joint, and she's staying for a week, and she's gotten 4 treatments. So it's up to different people what they need and what they want. If someone flies in from far away, we're going to probably do more treatments close together. And if someone lives close by, like Orange County where you're at, it might be once every couple of weeks or longer, depending on your schedule and what
How
works
would
for
you
you.
determine if it's working?
You determine that. I don't.
Okay.
Does that make sense to
Well, I
you?
look forward to your book, and I'll make an appointment and
Yeah.
get the exact address.
Yeah, I don't want to
your
belabor
office.
this point, but this is what's really important. People can have all kinds of diagnoses that we find by doing MRIs in studies on people that have no pain. And they have meniscal tears, they have rotator cuff tears, they have disc bulging, you name it. And we say, well, you have this, and they go, but I'm fine. So it's not the diagnosis that we treat the patient. And if you say, I'm better, We don't care if you have a meniscal tear. Do you understand that? You don't get it. It's okay.
No, I understand.
Okay, good. It's not the diagnosis. It's what's going on. It's where the pain is being generated from. Your pain may have nothing to do with your meniscal tear in your knee. I have no pain in my knees. I just ran last night, and I have meniscal tears in both knees. Do you understand that? But I've injected my
I
knees.
think you're a lot younger, too.
How old are you?
80.
Yeah, I am. I'm 74. And I've had a lifetime of sports.
Hey, the 70s, I didn't realize how good they were. Okay.
Yeah. You know, I'm going to tell you something. Carol, I'm going to tell you something. I have patients come in their 90s all the time who are in great shape. Yeah, they're guys.
I hope to see you soon.
Good,
Thank
good.
you so much.
Sure. I have men and women who come in all the time in their 80s and 90s. And then I have kids come in. You know, we have very young athletes that come in. And a lot of people come in when it's not athletically originated. But, you know, arthritis is a big thing. And people trip and fall and they overuse joints. And there's just all kinds of reasons that people have pain. So there's good hope for you, Carol. Really is. I just have to see it to confirm.
I look forward to seeing you.
God bless you. Thank you so much.
Thank you.
God bless you, too. Thank you.
All right, so I'm going to give out the phone number for the rest of you who want to call in. That number is 866-870-5752. I'll repeat it while you grab your pencil. It's 866-870-5752. And if you want to catch me at the office, the phone number there is 800-300-9300. That's 800-300-9300. Another great way to get a hold of me is to go to the website, which is www.lastemcells.com, www.lastemcells.com. And my website will educate everybody, including your doctors, about how this stuff works, how regenerative medicine using platelets and stem cells really does work. This is not anecdotal. This has been studied. The book I'm going to send you if you call in, it's free for those who call in. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And there are, I think, 264 studies in there, which are all peer-reviewed studies on how regenerative medicine does work, how it grows tissue and heals, and how surgeries are really dinosaurs today. There are surgeries that do need to be done, but the ones I see should never have been done because the people coming afterwards, when they got worse. So what good was the surgery? And I'm a guy who had the surgery on my shoulder when I was in medical school, before I knew about stem cells and platelets and prolotherapy and all those things. And I suffered very gravely. My shoulder blew up like a balloon full of fluid after my surgery. I loved my surgeon. He was my professor. But the surgery came out bad. And I learned immediately that that was something that I may not be doing because I was planning on being a surgeon. That woke me up. And then I found stem cells, platelets, prolotherapy, and other things we injected back in the old days. And I had great success on my shoulder. And we're going to go to Penelope in San Pedro. Penelope, Dr. Marc Darrow, you have leg pain, hand pain, and arm pain. Which is the worst?
I believe they're pretty well even.
Okay.
My legs probably more so than anything. I didn't know if it was a nerve problem
Okay.
or what the heck is wrong.
Okay. Well, what did your doctors tell you?
You know what? I let my doctors know. I just tell them there's burning, and my doctor kind of just, oh well, we get involved in something else, and she's not really. We're not really on this like I should be. I think.
Okay. So
I wake up and it's pretty. Sometimes it's hard to walk on my legs.
Okay. Have you been to a rheumatologist to get blood drawn?
I haven't.
I think that's the first thing you should do. They're all over the place. You can find one, and see if you have some kind of rheumatological disorder. Also, you may need to get an EMG and nerve conduction study to see if you have what's called a radiculopathy. That means you could have a pinched nerve in your neck or your back that's causing these legs and arm stuff. What else is going on? Do you have any joint pain, any back pain, any neck pain?
Yeah, well, a while back, they said I had ruptured discs.
Okay. Well, that could be the problem.
Okay.
We have to check you out and see what's going on.
Okay.
I don't know enough from your case to tell you exactly what it is. And I would say go to those doctors I mentioned and see if they can get to the root of what's going on.
And then go from there.
Yeah. And in your case, I would love to get an MRI to see if you have any nerve impingement. And then for sure, the EMG and nerve conduction study to see if you have a radiculopathy. Radiculopathy means it comes from the word radix, is where the nerve roots come out of the spinal cord. And when they're impinged, we get what's called a radiculopathy. Pathy just means disease. It's not really a disease that's going to eat you up, but it just means a disorder. And that radix is being squeezed, and it's like a water hose. You can pinch it or bend it in half and the water doesn't come out. The electricity down the limbs doesn't adequately suffice, and then you get what we call paresthesias, which are funny feelings or pain or numbness. So you're an enigma to me right at this moment, but I think we can get to the bottom of it. You also may have something called a peripheral neuropathy, and that the EMG and nerve conduction study can help us figure out. And sometimes that's from vitamin deficiencies, and there's tests to find that out.
They said I was deficient in vitamin A.
Okay.
I mean, not A, but D.
Okay. In our country, everybody's deficient in vitamin D because we don't.
Okay.
Yeah, I mean, people who are out in the sun, like lifeguards or something like that, or contractors who work with their shirts off, they get enough vitamin D because it's produced in the skin. But the average person who's not in the sun very much is low in vitamin D. Usually, when I check them, their level is about 30, and it should be up around 80. And the typical dose I give people is about 10,000 units a day with vitamin K mixed in it, so that the calcium that's generated goes into the bones instead of the arteries. But that's something we're not really here to talk about on the show. That's just a little extra. After my residency in physical medicine rehab at UCLA, I did another fellowship on natural medicine and hormones. So I keep studying. I did another 3-year course on acupuncture, and I'm always studying. I'm always moving ahead in medicine. I am not locked into the traditional medicine that I learned at UCLA and in medical school. I use that, of course, that's the basics of how to keep people from dying. But most people that are not feeling good, traditional medicine does not work on. Doing surgery and giving medications to people is really not the way to heal them. So we have to go a lot further to get into the healing realm. And so I continue to study. I learn new things every day. I actually learn a lot from my patients. I get patients who come in who've had massive healings by doing what is called alternative medicine. And to me, it's not alternative. If it works, it's real. To me, traditional medicine is alternative and should be used as a last measure. Why are you going to give people medications that have side effects? Why are you going to give people surgery that has terrible side effects? I don't like that. Sometimes it's needed. There's no question about it. But there's simple things to do that are natural. Let's say high blood pressure. Let's say high insulin. Let's say heart disease, cancer. Change your diet. Get on a low glycemic index diet, what we call a ketogenic diet. That gets rid of a lot of those things. There's just endless ways to heal, and traditional medicine doesn't teach us those, unfortunately.
Well, I do have the high blood pressure. It's amazing that you said that.
Okay,
and,
well,
I just hate taking all those pills they assign to me.
Well, I don't blame you because they have side effects, but sometimes you need to take medicine. It just depends. But
Yeah.
way too many people that I see come in shouldn't be taking the medicines they're on, and they're just too lazy to take care of their health.
Well, I like to eat good, and I really I'm against anything that's foreign like that. I'd rather have natural.
Well, the main thing with diet is just staying away from carbohydrates. Stay away from grain and things that raise your insulin. Once the insulin goes up, you're set for disease. Plus, it stores fat. You don't want to be storing fat. You want to be eating your fat. Anyway, that's a whole different discussion. So go ahead and go to those doctors I told you to see. Get those things I asked you to do. Let's get to the root cause of all this. And God bless you, and hopefully you heal up. Okay?
God bless you, too. And I'm a fan of Suzanne Summers for years.
Oh, my God, she's an amazing person. Yeah, amazing.
She is.
All right, well, God bless you. We're going to move on. And I'm going to give out the phone number so we can get some more callers in before the end of the show. The phone number to call us right now is 866-870-5752. I'm going to send you out a free copy of my book, Stem Cell and Platelet Therapy. It's about 200 pages long, 264 actual research studies on how regenerative medicine using platelets and stem cells is amazing for people, how it heals them, and how surgery is antiquated for most of these things that it's being done on and really shouldn't be done. There's studies that show that if you do a fake surgery versus a real surgery, your results are going to be the same. So why do the real one and have potential for terrible side effects, infection, and other things that can happen when you can get to the same place without the surgery? I know that sounds crazy, but that's what's been researched. And I recently read that the Veterans Administration, which deals with all of our soldiers and Marines and Navy SEALs and all that, is actually stopping surgeries now because they're finding out that they're not working. So why should they spend all the money and give all the grief to these poor veterans when it's not working? So
That's
be
fantastic.
careful before it is. Before you get a surgery, check it out with someone who's not a surgeon, who does regenerative medicine, to see if they can help you. So I've been doing this, I think, 25 years now, and I've had great success on my body. I self-inject. Anytime I'm injured, I still get injured. I'm 74, but I still am a little crazy with sports. I know I do more than I should, but what was that song, Don't Let the Old Man In? Clint Eastwood had a movie that I think that song was played on, and he's still making movies. He was in his 80s. So, don't let the old man or the old woman in. You got to stay active. And the two most important things are activity and nutrition. And they're both easy to do. You can just walk, Walking is a great exercise if that's all you can do, whatever it is. If you can't walk, lift some weights. Do something. We find that there's a lot of health even in weightlifting because you get more mitochondria, which are the energy sources that come in the muscle. And the more you work out, the more of those you have. So you get to burn all of the fats you're eating and all the carbohydrates you're eating. By the way, people don't believe this, but eating fat is actually very good for you. The right fats. Yeah, the right oils. And eating carbs is never good for people, other than slow-burning carbs that you get from vegetables. So the keto diet, which I love, is lots and lots of vegetables and some protein, and stay away from all of the sugars, all of the grains, all of those things that raise our insulin. We want to keep our insulin very, very, very low. That's the killer. It's inflammatory, and it creates all kinds of disease and heart disease and other issues. Well, God bless you all. Thank you, Nita Valens. You're a great host. Thank you, Alex and Suzette and all the rest of the team. And if you want to get a hold of me at the office, it's 800-300-9300. God bless you all.
And listen to our pal Warren Eckstein on The Pet Show every Saturday, 11 to 1. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, You can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.